I now call the Liberal Democrat spokesperson, Jess Brown-Fuller.
Thank you, Madam Deputy Speaker, and thank you to my honourable friend for North Shropshire for bringing forward this important debate on our first day back after Christmas, and thank all honourable members from across the House for their contribution to the debate. But I would like to specifically thank the honourable member for Runnymede and Weybridge, the honourable member for Ashford, and the honourable member for Bury St Edmunds and Stowmarket, who always bring really valuable contributions because of their background and current professions. It's very much appreciated when we're talking about the NHS. And the honourable member for North Shropshire, in her opening remarks, highlighted to the House that it's not just about NHS waiting lists when we think about backlogs. It's mental health backlogs, handover delays, A&E waiting lists, poor access to dentistry, GP appointments, cancer treatment waiting times, and staff that are being driven from the NHS because they can't provide the care that they want to give. Our healthcare system remains the number one issue that I am contacted about, and it is not unreasonable for my constituents in Chichester and across the country to expect to receive the care they need, when they need it, and where they need it. And I doubt there are many people that have not been affected or know somebody affected by NHS backlogs. Indeed, my dad struggled for months to get a face-to-face GP appointment for what he believed was a return of a hiatus hernia. But by the time he saw his GP and was referred, the esophageal cancer that he had was so progressed that only palliative care was an option for him, and he passed away shortly after being diagnosed in 2021. And when I asked my constituents to get in touch with their examples of personal experiences with the NHS backlogs, I was inundated with emails from people across Chichester, and I would like to share some of those with the House today. So I have Jane, who is at high risk of bowel cancer due to living with ulcerative colitis and is meant to see her consultant every 6 months, but she hasn't had an appointment since 2019, despite her GP trying on her behalf on multiple occasions. She has no idea if the polyps that they discovered in 2017 have turned cancerous and is living in constant fear of her health deteriorating further. Or Ian, who got in touch after waiting over a year to receive a scan after he experienced some extreme chest pain. The scan then revealed heart disease, but without any follow-up appointments, this has left him anxious and uncertain about his health. And I will also mention a good friend of mine, Riley. Riley noticed irregular bruising and a physical change on the back of their leg in 2021 and was finding it harder to walk. After visiting the GP, who sent an urgent referral to the hospital, Riley then waited months, only to discover when chasing the hospital that the referral had gone to the wrong place. They then got added to the waiting list, and they were told that that would be 40 to 50 weeks. We're 4 years on from the initial changes to Riley's leg, and they are finally being treated by leading specialists as Riley can no longer walk unaided. Amputation of their leg is now being considered. If Riley had been seen within the expected window of an urgent referral, they wouldn't be facing the prospect of losing their leg in their mid-20s. These are just a few examples of what is a much larger picture of the NHS with caring, compassionate staff working within it who are overstretched and overburdened, and as the Honourable Member for North Shropshire said, cannot provide the care that they desperately want to because of a system that cannot meet the demand. The Liberal Democrats recognise this is an inherited problem. Indeed, the key NHS waiting time standards have not been met for some years. The number of patients waiting longer than 4 hours in A&E rose consistently between 2015 and 2020. The 62-day waiting time for standard cancer treatment has not been met in recent years, and in England, the consultant-led treatment target of 18 weeks has not been met since 2016. The last Conservative government left emergency care in a deep crisis. The Darcy review stated that in 2024, every day, 800 working days have been lost to handover delays. Last winter, ambulances across England collectively spent a total of 112 years waiting outside hospitals to hand patients over. And in 2024, over 1 million patients faced waits of over 12 hours in A&E. So Liberal Democrats welcome new investment in the NHS. But instead of spending money firefighting crisis after crisis, we would invest to save taxpayers' money in the long run. We would do that by investing in the front door, and the back door, in primary care with GPs and dentists, and by reforming social care. Some of my constituents would like it noted that they won't be counted on any statistics regarding backlogs because they can't get a GP appointment to even get on the backlog list. That's why the Liberal Democrats are calling for everyone to have the right to see their GP within 7 days or 24 hours if it's urgent, the 24/7 booking system to end the 8 a.m. phone call lottery to get an appointment. And we'd also ensure that everybody over the age of 70 and those with a long-term condition has access to a named GP. We'd fix the back door and address the social care crisis now, rather than spending another 3 years commissioning a report that will find out what we already know, that social care is in urgent need of reform. The DASI review showed that inadequate social care accounts for 13% of hospital beds, meaning people who desperately want to get home can't because of a lack of social care packages available, or those deteriorating at home because they can't access the social care they need, as in the last year, over half of all requests for social care were unsuccessful. And we would strengthen our emergency services to reduce excessive handover delays by increasing the number of staffed hospital beds and calling for a qualified clinician in every A&E waiting room to ensure any deteriorating conditions are picked up on to prevent tragic, avoidable incidents. Madam Deputy Speaker, I'd like to once again thank the Honourable Member for North Shropshire for bringing forward this incredibly important debate, and to those members who contributed to a conversation that matters to my constituents in Chichester and across the country. Yeah.